COVID-19. Around March the 20th, around that week, as general practice, we were asked to stop working. So for me, that meant not going into the practice to treat patients anymore, essentially downing tools until we knew what was going on. And the main thing was trying to slow down or prevent the transmission of the virus. So I just want to find out from your side, Stewart, how things changed. So for us, that initial week, it was, okay, we're not going to work whilst this is getting figured out. All we're doing is we are handling phone calls, emergency phone calls, and we are giving advice. We're giving analgesics, painkillers, recommending them, or prescribing antibiotics. And essentially, that's all we can do because we can't actually treat patients. How were things for you when the news came that we had to change what we're doing within dentistry?
Yeah, so I was quite similar actually. I think I was at Liverpool Dental Hospital, and it was quite quick on the ground that they changed things. We stopped doing aerosol generating procedures, which is quite a lot of stuff. So we kind of moved to a similar model that Arnie explained, in the sense that we would still have face-to-face patients. So we're still having consultation appointments, not with any of the PPE or anything that's been obviously discussed in the media and things, just normal masks and gloves. And then as the COVID situation progressed, basically the dental hospital stopped all elective functions as per guidance from the NHS, because basically dentistry in almost 90% of cases elective, so that was fundamentally stopped. And then the service changed to basically
at that point, because you mainly get referred patients.
Yeah.
So you had to almost have a cut off to say these have been referred, but we're not going to be seeing them anymore.
Yeah. So I think that they stopped. They almost said, obviously, whatever date it was, I can't remember, on that referral date, they won't see anyone. Right. So it was basically just continually put back. So I imagine the waiting list in all hospitals are going to be much longer than what they were 2-3 months ago. Okay. Additionally, we had patients that were having treatment. So obviously, patients who are having prolonged treatment in the dental hospital, they basically had to stop treatment midway through. And I'm sure that was reasonably similar for lots of patients in general practice as well. So we had to stop them, and then unfortunately just gave them a phone call and said we'll rearrange when the situation's changed. So those people kind of left in the middle of treatment, really, which is not ideal, but obviously there's not anything else that you can do at the moment.
So at that point where we were just doing the phone calls, I think that went on for about 6 weeks. And then we found out as a practice that we were going to be one of the urgent dental care centers. So that meant that we would be able to see patients for emergencies, but we were a cold site. So we weren't going to be doing any aerosol generating procedures. So, in dentistry, some of the procedures using the hand pieces, the drills, you cause aerosols, and aerosols mean that the virus can spread more easily. So we were not doing any aerosol generating procedures, but we're doing mainly extractions, so taking out teeth, or placing temporary fillings where you're not having to do any drilling at all. So it's limited, but it's better than what we're able to do before. So I think the major difference in our practice is the fact that you only have one dentist a day. So we're a 5-surgery practice. Normally we've got 5 dentists working at the same time, Monday to Friday. And now it's changed that you've only got one dentist. The patient rings to say that they're leaving the house. they ring once they're outside in the car park, and then we ring them in to get them to come in. They come in with their own pen, they sign documentation, they get PPE, and then they're escorted into the surgery. And then once that's done, once their treatment is done, we leave that surgery and go to a different surgery and see the next patient in a different surgery. And where you might have seen a patient over 15 to 30 minutes, now it's taken an hour to get through one patient. So that's been a big change, massive change for us, in that we're seeing, less patients, far less patients, and the protocol is quite strict. I mean, how would you say it's changed for you, or has it changed much?
Well, yeah, it's a pretty similar system to what you've explained. So for me personally, lots of the dental core trainees have actually been moved to different parts of the NHS. So
okay, so redeployment.
Yeah, so redeployment. So before we touch on that, the dental hospital, because it's a big unit, they've kept people there, and that's one of these emergency dental units that's covering the whole of Merseyside, really.
All right.
I think they're able to do aerosol generating procedures because they have the full PPE. So that's how that works. And then some of the staff have been redeployed. Well, quite a lot of the staff have been redeployed. So I'm working in a max fax unit at a kids' hospital at Alder Hay at the moment, whereas I'm reasonably comfortable doing that. However, some of my colleagues have been sent to respiratory wards, are on accident emergency, are on gastroenterology, are doing obs and gynae. So it's completely non-dentistry based stuff. So they're basically acting as almost like junior doctors for, well, it's been like 2 months now, hasn't it? So
what's the experience been like, having to learn essentially new skills to help out?
Well, they've said it's hard just because it's something so different, but they've had so much support from like medical colleagues, nurses and doctors that it's been okay actually. There's not too much of expected of them, and they can naturally sort of grow and progress as they understand things. And I think sort of the overriding message from the medics and the nurses, they're just helpful for a little bit of extra support, frankly.
Yeah.
Because there's been a natural redeployment of all services, doctors, and everything's been obviously redeployed within hospitals. So even though COVID is basically affecting ITU and things, it's affecting hospital and different wards generally as well.
How's your day-to-day changed up to now?
So the main thing that's changed for us is I used to be 9 to 5 and then an on-call commitment. That's reduced, and the reason it's reduced is that obviously they don't want that many people in a unit at the same time, just in case they infect other people. So at the moment I'm just working on-call shifts a few times a week.
Yeah.
So it's probably a reduced amount that I do, but in terms of the shifts, they're a lot longer. And the idea behind it is obviously just to limit the exposure of me to patients, and obviously patients to me as well, and my exposure to other members of staff as well.
So when you're in, what are you actually doing in terms of treatment, or
Yeah, so it's a combination of things. At the kiddies hospital now, they've just started opening up some of the extraction lists. Okay. So it's starting to take some more teeth out, which is good. I still cover a lot of emergencies, so it's a lot of dental swellings, lots of trauma, which again is starting to potentially creep up a little bit because of lockdown starting to be eased a little bit. Kids and parents are starting to go out a little bit more, so there's a little bit more trauma from kids falling off bikes and stuff, and that's slowly starting to increase.
Okay, all right. And going forward, have you heard any news on your end about when things might relax?
No, not really yet. We're not really sure how it's going to continue, and we're probably equally as dark, because ultimately if you're a dentist in a dental hospital or a dentist in general practice, the same sort of conditions are going to have to be in place, the same disinfectant, the same PPE, etc. are going to have to be the same.
Yeah.
I think I don't know. Frankly, I don't know how it's going to work. I actually think general dentists will probably be ahead of dental hospital in terms of when they go back, because there's different factors at play, isn't there, for practice owners and general dentists that salaried dentists don't have.
I think that's one of the main concerns with self-employed dentists or dental associates, in that it's not quite clear how it's going to work out in terms of getting paid going forward. It's all unknown, should we say, until we can get some more news on how dentistry can work going forward. I mean, people will always have dental issues, dental problems, but I guess the system has now got to be changed to work with where we are now.
Yeah, I think there'll be an element of, I think the main determinant will be time with patients, won't it? Because the disinfection after a patient's been in dentistry, in terms of keeping everywhere clean, is probably the most regulated healthcare profession.
Yeah.
So the standards of dentistry, keeping areas clean, is probably quite high, but the expectations will probably be even higher. So I think your time spent with patients might be the same, but the actual clinical time might be different, because you're going to have to spend a lot of time disinfecting a room after a patient, unfortunately.
All right.
But no one knows at the moment.
Until we hear further news.
Yeah, fingers crossed soon.
Yeah. All right. Thanks for that, Stuart.